Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
So welcome everyone to the Pharmacy Leaders Podcast. My name is Ahmed Ahmed, and I'm actually a third-year pharmacy student from the University of Iowa College of Pharmacy. And today I will be interviewing Mike Case-Haub, who is the CEO and founder of Case Haub Consultants. And basically this company is a consulting business that he started a few years back. And so we're just going to ask him a few questions about his company. Mike, how are you doing?
Good. Thanks, Ahmed. How are you today?
Good. So the first question I have here for you is, when was your aha moment and when did you start your business?
So our aha moment, well, let's see. We started the company back in October of 2014. So we're still a fairly new company, kind of a startup, still in that kind of category. Really, my aha moment was I had been working as a pharmacy manager, as a kind of a store manager for a local pharmacy, and we actually were robbed. So we got robbed at knife point. And then a couple weeks later, we got robbed at gunpoint. And at that point, I'd already started the consulting company, but I was kind of just doing that on the side. My wife was a stay-at-home mom at that point, had three small boys. And, really, I was the sole breadwinner for the house. And but, was just kind of this consulting company going. And I kind of felt like, well, maybe the universe was telling me something, that maybe it was time to get out of a retail pharmacy. And if I was really going to make this consulting company, hopefully get off the ground, I kind of needed to put all my, eggs in that basket. And that's pretty scary, to be very honest. But, at least from my perspective, if I was really going to make it go and hopefully be successful with it, I really had to, again, put all my chips in and really to really focus on that full time. And so really after that had happened, I put in my notice to my current employer at that point, and then it kind of all just fell into place after that. So it was that was kind of my aha moment, was like I really need to kind of focus on this company and throw caution to the wind and kind of take on some risk there and go from there. Absolutely.
And just to kind of expand on what you said about the whole putting all your eggs in one basket. So what did it take for you to ensure your business would be successful, so you would be comfortable basically leaving a normal revenue stream behind and allowing yourself to take this new one on?
As an entrepreneur, there's no level of comfort from my perspective. You never know. In so many businesses, you have to be willing to fail, and there's very few businesses out there that the founder or the CEO or whoever's kind of got that company up and going, likely they've had numerous unsuccessful companies before that. So I think it's a little bit of faith. It's, of course, belief in your company and your model and what your vision is. I think that's really important, but you also have to understand that you may fail and you have to be okay with that. And I know that's probably not something people really want to hear, but it is something that, to make your company be successful, you have to be willing to be flexible, and you're going to fail on certain parts, but hopefully, kind of like the old adage goes, if you may have lost the battle, but you haven't lost the war kind of mentality, is that, there's going to be times you're going to lose a client, or there's going to be times that you're going to be financially really struggling with certain things. And then there's other times that you're going to be doing a great job. And so it's more of a, I always tell people it's more of a marathon than a sprint. So we have to kind of have what's our long-term strategy, and knowing that there is going to be ebb and flow, and you just have to be comfortable with that. And if you're not comfortable with that, being an entrepreneur is probably not what you need to be doing. You need to probably find a more stable, profession. And, if you just want to clock in and clock out and do your 9-to-5s or whatever kind of job you want to do, that's great. That's generally not the mentality of those people that want to be an entrepreneur, though.
Got it. And just in terms of successes and failures, because we are all taught that we're not shaped by our successes, but rather our reaction to our failures.
Yep.
So what was your worst entrepreneurial moment since you've started the business?
First one. So this happened not too long after I decided to quit my stable full-time job. So we had a number of clients at that point, but our largest client at that point, this was probably about 3 or 4 months after I again quit my full-time job and was doing this full-time. Our largest client at that point was acquired, and so through that acquisition, they pretty much had to say, well, we weren't going to work with certain client or certain vendors anymore and that type of stuff. We're just trying to figure those things out. So, so unfortunately, right after I decided to put all my eggs in this basket, that those eggs kind of got scrambled up pretty well. So we were struggling there for a little while to try to figure out what the next steps were going to be, and we had other clients in too, and so we were okay. But it definitely that definitely hurt. Now eventually that client did come back to us, so. We were really happy with that. It's just, in this world of healthcare, as we're all pretty much aware, there are a lot of acquisitions and mergers and that type of stuff then too. And so you do have to be willing to kind of ride out that wave a little bit. And that's something that we've definitely learned firsthand for sure.
Okay. Got it. No, absolutely. And so say we went back in time to when you first started your business, Case Haub Consultants. What would you say your mission at the outset was?
Yeah, I would really say, the mission or kind of what the vision is for the company is that I have personally felt like the practice of pharmacy is definitely moving in a different direction than where it's been at traditionally. My vision was to really move us away from product distribution and really try to focus on cognitive services. And I wanted a model where I didn't have to dispense a product or get paid or reimbursed for the product per se, but to actually pay pharmacists and have a model where we are getting paid to use our brains. I mean, I'm not saying you're not using your brains if you're dispensing, but that's all that we're doing. We're focusing, working with patients directly, and how do we get pharmacists really involved in those types of models? And I think it's pretty challenging because, as we know, for the most part, pharmacists aren't reimbursed directly by payers, for the most part. I mean, there's some exceptions and that kind of stuff, but in general, that's a very challenging model. So what we've tried to do is really focus on how can we collaborate and work directly with physician clinics and health plans and health systems and really show the value of what pharmacists can do. The other big component that we wanted to focus on is I really wanted to move the needle. I wanted to have scalability. I wanted to not just have, hey, I've got 4 pharmacists that can do this work. I wanted to have the ability to say, hey, I've got 400 or I've got 4,000 or who knows, I've got 4 million, whatever that looks like. But I'd be able to scale that up because I feel like there's a lot of pharmacists out there that want to do this kind of work. And there's a lot of patients out there that need this kind of work or, these kind of services to be provided to them. So what we really want to do is create that almost turnkey solution where we can plug those pharmacists into that model. I kind of tell people I kind of feel like we're Uber for pharmacy, kind of where we've tried to create this model where we're connecting patients with pharmacists that want to do this kind of work. And I think that the cool thing is that since our pharmacists are doing this kind of work all the time, just like anything, if you don't do something very frequently, you're probably not going to be very good at it. So for our folks, because they're doing this kind of work all the time, they're really good about how to have those conversations with patients and how to identify drug therapy problems and resolve those drug therapy problems and have conversations with physicians and how to kind of get those things going. And it's been really interesting. And I think there's a ton more that we can be doing to advance the practice of pharmacy. And I think something I struggle with, and I think we struggle with as a profession, is that I think we as pharmacists are really good about patting ourselves on the back and say, hey, we're doing such a great job. But outside of pharmacy, nobody really knows what pharmacists do, or there's this mentality of, oh, well, they just fill prescriptions, or they're, in the basement of the hospital and that kind of stuff then as well too. And so by us directly trying to interface with physicians and other, leaders within healthcare, I think there's a lot of value to that because we can help start shaping or changing the practice of not just pharmacy, but how our patients manage within the healthcare spectrum. And I think if you think about how many patients are hospitalized or have readmissions or have to go to the ER or, have all these chronic conditions, most of those patients are going to be managed by using medications. And we as pharmacists are the medication experts. And so how do we get plugged into that team and get reimbursed for that service is something we struggle with every day. But I think we're starting to crack through some of those barriers. And I think we've had some pretty good success on trying to create those kind of models and have them be scalable.
Absolutely. And just to expand on that, a big thing that people do not think about is marketing your business or marketing what we do as pharmacists even. So how do you market yourself to the, doctor's offices or just other pharmacies, insurance companies to tell them like, I have this value that I will be able to give to your company or give to your office. And therefore, like, how do you basically market yourself and Case Haub Consultants?
Yeah, marketing it's a challenge because, of course, we have our website and we have marketing materials and that kind of stuff then as well, too. But a lot of it is, I would say pharmacy, our family tree has very few branches on it. So it's kind of who you know. And, I feel like we're pretty well known in the industry, or, I know different folks and they know different folks, and you kind of have those collaborations, and you never know what conversation is going to kind of open up that door for the next potential client that kind of comes down the road. So, we haven't really done a ton of, direct to consumer advertising or that kind of stuff. It's really more focused on, again, connecting with the right folks within the industry, and just kind of be on the lookout for different opportunities as they come up. Now, we have looked at doing direct to consumer advertising, and where we feel like there's a model, like a concierge model, where we could work directly with patients to help them as advocates. We could help them, doing medication reviews, or we've even looked at a model of kind of a virtual pharmacist on demand, where when a patient is, at their physician's office while they're waiting for the doctor to come in, we could actually virtually pop in, do a med review or a med rec, or do whatever we need to do with that patient, and then have that conversation with the physician when they come in the room then as well too. So it's kind of a model where we could have pharmacists in a clinic, but they're not physically there. They're virtually there, and there's a lot of scalability. And I think as technology continues to improve, I think telehealth and telepharmacy and, fill in the blank is going to become an even huger part of what we are doing in healthcare, not just what pharmacists can be doing. But I think we're just trying to think about different models and how can we fit into that in a model that's pretty innovative if possible.
For sure. And just also something that we wanted to ask you was, in terms of employees that you have at Case Haub Consultants, because we did mention a few numbers earlier, but how many pharmacists, technicians, and do you have employees that aren't pharmacists or technicians?
Yeah, so right now, our model is really, we're contracting with a lot of pharmacists to do this type of work. So we've got probably around 300 contracted pharmacists that work with us. And then as far as employees go, we have about 25 employees right now that work for us. The vast majority, we do have some pharmacists that work for us as, management and that type of stuff as well too. And then we do have pharmacy technicians and pharmacy students. That's the vast majority of the folks that work for us. We do have a business operations analyst that works for us as well too. But for the most part, it's pharmacists, pharmacy students, and or pharmacy technicians that are working for us.
Got it. Okay. That's pretty awesome. You definitely have employed a lot of people. So that's great.
We keep growing, so it's just great.
Awesome. And so now a lot of students listen to this podcast and people who might be interested in the business. So maybe you can tell us a little bit about how many hours or just like day to day, how many hours you put into work, maybe at the start of your business when back in 2014 compared to now? Have you been able to slow down and have some fun, or is it just work, work, work?
That guy's not
I
slowing
wish
down.
that was one of the main reasons I wanted to start this company as well too, was to try to figure out more work-life balance. I was working very hard at lots of different companies that I worked at before, and which is great. I mean, I think working hard is really important then too. But as I mentioned before, I've got three boys and a lovely wife, and I like being married, and I'd like to stay being married if possible. So those things we're trying to kind of balance some of those types of things out then too. And so what I do like about our company is that we do have that flexibility. And so if one of my boys has if we've got a soccer game today, or we've got baseball, or there's a play or student teacher conferences or whatever we need to do, I can go to those types of things, where before, if I'm working the bench and I'm scheduled that day, I have to go to work. And so it's just a different type of model, or kind of a different structure than what we traditionally think about from what pharmacists do. As far as how many hours we work, there's kind of this old saying, I in the entrepreneurial world of I work 80 hours a week, so I don't have to work 40. And I'm sure you understand what that means, but in a nutshell, it's just saying that I'm willing to work a lot of hours for myself, so I don't have to work 40 hours for somebody else every week then too.
Wow.
And it's it is a balance, because it's exhausting. I will not sugarcoat it at all. It is very exhausting. I mean, I'm going in 50 directions at all times, but it's also rejuvenating a little bit as well too, because I love what I do. I love what we're trying to do. I'm passionate about it. But I'm also burning the candle from three different ends then too. And so I think just trying to find that balance, and as we keep growing, we're able to bring on additional management to help with all the day-to-day operations and all the different stuff that we have to do, and focusing on strategy and sales and all the things that have to happen within a company. And it's a lot of work. I mean, I'll be very, very honest. It's a very challenging thing that we've kind of created here. But again, if I wasn't challenged, I'd probably get bored, and I wouldn't want to really do it much longer than as well either. And it's, for me, it's fun because we get to talk about our profession, and I get to talk to and work with students and pharmacy techs and pharmacists, and talk to health plans and talk to physicians and all these different groups that we talk to. And I could have a conversation with somebody this afternoon, and we love what we're wanting to do together, and we could start doing it tomorrow. And that's the big advantage that I've liked about the company, is that we can be very nimble. We can make changes on a dime for the most part if we need to. And if there's something cool we want to try out, well, then we can try it out. And it's not this is going to take a year for us to figure out all the ins and outs and the nuances and that kind of stuff. If there's something we truly want to do, we can do that pretty quickly without having to go through a lot of red tape.
Got it. For sure. And you did mention, so you're working about 80 hours a week, maybe a little more, just to not work 40 hours. I thought that was a pretty powerful statement. And just, do you feel like it's actually, let's see, like more significantly more fulfilling to be a business owner in the field of pharmacy, as opposed to, working as a community pharmacist, hospital pharmacist, and in terms of not only flexibility, but revenue and things of that sort as well?
I think for me, it's more fulfilling, but I would definitely not say everybody would, want to do this or like to do it as well either. So, for me, it was, I just kind of had this itch that I had to keep scratching, that I wanted to kind of push the boundaries. I wanted to try something different. That's just kind of been my personality, for as long as I can remember, is that, when I was in pharmacy school, for example, I worked in a lot of different types of pharmacies. I worked full time when I was in pharmacy school as well, too. And so, I worked in a hospital, worked with investigational drugs, worked with, Iowa Medicaid, worked with, a lot of different retail settings, tried to do a lot of different things because I wanted those experiences to try to figure out what did I want to be when I grow up. And kind of every day I ask myself that same question, what do I want to do when I grow up then too? And so trying to create that, create what I want to do when I grow up and not necessarily have to have somebody else create that and me kind of fit into that. I want to be the molder, and I want to be the one that kind of creates that and figures out what that is. And that doesn't mean that I know exactly what that looks like and what it needs to be, because I take a lot of input from a lot of different people that I trust within the industry that are able to feed me information or say, hey, have you thought about this? And so I want to be really open-minded to that, because I think those are the kind of companies that are very successful long-term, that have that ability to be a little bit pliable, be able to absorb different ways of thinking. And and I think surrounding myself with those kind of folks is really important as well too. I want people that question and people that think. I hate saying think outside the box because that's such a cliche, but I think having those people that are willing to question authority, or question why is the institution set up the way it is right now. I think that there is a lot of value to that, and trying to break some of those molds and shift some of those paradigms that are currently in place.
Oh yeah. And just to go off what you said with the whole thinking outside of the box and being cliche, I heard the saying that the secrets in life are hidden behind the word cliche. Just work out to lose weight, or thinking outside of the box to come up with new ideas. They are cliches, but I feel like that's what we really have to go. That's how we have to go about things, is do the cliche things to become successful at whatever you want to do.
Makes sense.
Exactly. Yeah. And just lastly here, Mike, in terms of just people who are aspiring to be entrepreneurs in the field of pharmacy, or just entrepreneurs in general, what's some advice you could leave us with for student pharmacists that are currently, and they're not sure what they want to do when they grow up, and other people who are interested in just the entrepreneurship or the entrepreneurial route?
Yeah, I think when I talk to students, I think something that I always try to instill in them a little bit is that what you're learning in pharmacy school is really important, and the clinical skills that you're getting and those types of value add skills that you're getting are really, really valuable. But on the flip side, don't expect the second you get out of pharmacy school that there's going to be all these amazing clinical opportunities for you, and whatever job you're going to go to, it's going to be exactly what you learned in pharmacy school. That's not the case. And you're kind of diluting yourself if you really think that is the case. And so you have to have the mindset of, this is what I want to do. You're going to have to go out and create those positions. You're going to have to go out and create those programs, because it's unlikely they're going to be there for you. And there's going to be some out there, but for the most part, you're going to have to create that yourself. Absolutely. So that's really, it's important to understand what does that look like, and how, from a business perspective, where do I even start? So, if you're working in a hospital and you're like, I want to start this new fill in the blank program, you're not just going to be able to go to the CEO, the CFO of the hospital and say, yeah, I want $1 million to create this program. And they're going to say, okay, well, I'm going to need a little more than that. You're going to need to have some business experience with that. And when I say business experience, that doesn't necessarily mean that you have to have an MBA or you have to go to business school and that kind of stuff. I feel like there's a lot that you can learn, because I don't have an MBA. I didn't go to business school. I've just kind of picked up stuff as I've gone along. And I think having that mind that kind of questions what's going on and try to absorb that kind of information, I think is really, really important. So, I would really just encourage students that maybe kind of get out of your bubble a little bit and know that when you get out in the real world, you're going to need to create your own space. You're going to need to create your own types of programs, and you're going to have to kind of push the envelope a little bit. And if you're not willing to, that's fine. But you may not be happy with the position that you're in, because that position was created by somebody else, and it's probably not the ideal position for you. So, be willing to get uncomfortable. Be willing to not just do what everybody else is doing. I think that's really important. There's nothing wrong with, I graduated from pharmacy school and I went and worked at, Walgreens for 2 years or whatever, or I went and worked at a hospital or whatever you want to do. And that's great if that's what you really want to do. But I also encourage people not to just settle, of just, throwing up their hands and say, well, this is just what I have to do. And, I think that there's everybody can be an entrepreneur. I think it's really just about what do you want to do, and don't settle. I mean, don't just do what everybody else does. I think that's really, really important.
All right, and you guys heard it here first. Everyone can be an entrepreneur.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.